also known as an aid to quit smoking. Now, that's not really the main reason we give this, but it can also help someone quit smoking. It is an antidepressant primarily. So we give it to help people lessen their obsession, lessen their reward center that they have to always constantly fulfill, and lessen the determination of a person if they have too much of an active psyche. Now, with your atypical antidepressant of wellbutrin, we're blocking dopamine primarily. We are not inhibiting amino acids like MAOIs, right? What we're doing here is we're blocking dopamine. So, we are not doing this guy here, but we still have our anticholinergic effects. So anticholinergic effects is we are dry, so dry mouth, blurry eyes, as well as constipation here. Some side effects here is we have weight loss can occur. We're not talking about tyramine foods. That's for your MAOI patients. One of the biggest things is that weight loss can occur because we've taken away or pretty much suppressing the communication of dopamine. You guys remember again, dopamine is that determination, that obsession, that pleasure, that reward, and sometimes compulsion. So, your patients might not have pleasure in their food any longer and have weight loss. So monitoring a weight is a big nursing intervention. As well as monitoring GI, because the GI can be upset, and this can also decrease the appetite. Now, obviously, if there's weight loss involved, this is not for anorexia patients or bulimia patients. So wellbutrin is contraindicated for those. On the other hand, SSRIs, your bulimia patients can have SSRIs. So you kind of see the flip-flop here. So for your wellbutrin, not for anorexia patients, not for bulimia patients. And one of the last things is it's not for seizure patients as well as MAOI patients. It can increase toxicity. So, no seizures for basically your seizure patients because we're limiting the dopamine inside the brain. And no